Now that we've talked about injuries and poisonings and adverse effects, let's go ahead and take a look at external causes of morbidity. This is Chapter 20, codes V01 to Y99. Those of you familiar with ICD-9, these are our E codes, what we used to remember as E codes, but now they're V and Y codes. It's really the same guidelines as ICD-9, so these are going to indicate the cause, the intent, the location, and or the status, activity status of the patient at the time that the injury or poisoning occurred. So they can be used with the whole range of codes, and a new change here is that these codes are actually used for the length of treatment. So those of you familiar with 9, typically your E code was just coded on that initial encounter and then you never saw that E code again. Well, now the cause is going to be coded, cause or intent I should say, is coded for the length of the treatment. So if a patient comes in, has a car accident, they come in for whiplash, let's say, they get the E code for the transport accident, they're discharged and they come back 2 weeks later because they're still having problems. They get another external cause code in that case. So now we have 7th character extensions to indicate that it's either the initial encounter or subsequent. We also can indicate that sequela. So these 7th character extensions look very familiar or similar to those out of the injuries chapter. Initial encounter is typically a letter A, subsequent is typically a letter D, and sequela is typically the letter S. We're also going to assign as many codes as we need to fully explain it. Now, if for some reason we can only code one external cause code, then we want to code that the one most related to principal diagnosis. Also remember, just like with E codes, these external cause codes can never be a principal diagnosis. So you're never going to have just an accident without some sort of injury or at least an observation for an injury code. So these are always going to be a secondary diagnosis. So I mentioned we'll look at cause and intent a little bit. We also have place of occurrence, which we had in ICD-9. It's now Y92. So these are secondary codes. These are only used on that initial encounter, so you don't need to use those again. They also don't have 7th character extensions. But they should be used, if you know, with in conjunction with Y93, which is an activity code. So these describe the activity of the patient at the time. Again, only used once, used in conjunction with Y92. And these aren't applicable to poisonings, adverse effects, or complications. And just a quick note that a work-related activity is any activity for which payment or income is received. And then the Y99 external cause status, this gets into like military status. So if that's known, that can be coded as well. So these are all considered additional external cause codes that would be coded in addition to the main external cause code indicating the cause of the injury. So in terms of sequencing, here's our main external cause code, then we'd have place of occurrence, activity, and then status. If there happen to be multiple causes, this is kind of the hierarchy that they take, and we should make sure that our first listed external cause code should correspond to the most serious diagnosis. Few more guidelines. If the intent is unknown or unspecified, kind of our default here is accidental. That undetermined that we looked at in the table of drugs and chemicals is meant for basically the physician can't determine. It's been undetermined and it's documented as undetermined in the documentation. We talked about late effects a little bit with injuries. It's the same kind of thing with the external cause codes. We're just going to add on that S for sequela. So we would get our sequela code, then you would have your sequela injury code, and you could have your sequela external cause code as well. Couple guidelines on terrorism. There is an FBI definition of terrorism. If it's identified as that, then we get the Y38 for terrorism. If it's suspected, then that's just classified as an assault. And then there also is Y38.9 terrorism with secondary effects. So here's our practice question. Patient burned when couch set on fire after falling asleep at home with a lit cigarette, subsequent encounter. Now before we even look up the codes on this, I'm sure some of you are thinking, wow, that's a really descriptive statement. And then along with that, you're thinking there's no way a physician's actually going to be that detailed when they write this down. That's one of the things I've noticed in ICD-10. These new external cause codes, holy smokes, are they specific. So I think in theory, If we were able to get the documentation, we could get some incredible data out of this. Again, I know the trauma registry is excited about this, but with the documentation, a lot of us see, I don't know that we'll ever get this specific, but I wanted to make it specific for the sake of a coding example. So let's flip over to our browser. So again, just like we had with the table of drugs and chemicals, we have another index. So this eCode index is what you'll need to use to access your external cause codes. Now, the codes themselves are found in the regular tabular, but the index to get there, you have to pull this one up. So I'm in that index right now, and it works the same way. It's got the hyperlinks across the top. I wanted to go ahead and scroll down and get to the right spot so you didn't have to watch me scroll forever. So we're looking at patient burned when couch set on fire. So I went to burn, and then there was a due to fire, and that sent me to exposure fire. So I'm now under exposure as a main term, fire, and then I went to uncontrolled. It's in a building because they're in their home, I believe, right? At home. And it's a sofa, and it was due to a cigarette. So we get this X08.11. And then let's go ahead and, so I'm going to copy that, and we're going to look at that in our tabular. So remember to just double check these in tabular, and make sure that you're in the right spot, and we need some of the character extensions. So exposure to sofa fire due to burning cigarette. Again, a lot of times we have to go back up to the category, and this one was the initial encounter. Oh, I'm sorry, subsequent encounter. So we're going to add a D on there. Now notice that I only have 5 characters, X08.11. I need to put a placeholder X, and then I can add my letter D. And then the other thing that we can get here is our location. So we know it was at home. So your best, I'm going to go back over to that index, your best main term is place of occurrence. So here's place of occurrence, and we should be able to scroll down. Those of you familiar with 9 will notice that this has been significantly expanded, and we get really, really specific in terms of where we are. So place of occurrence, we can go down to home. Residence, looks like we need to go to residence. So residence, and we're in the, we get Y92.009. Here's house, single family. This gets a little more specific, Y92.019. And then I suppose we could guess they were maybe in the living room, but who knows. So we get around this Y92.019, somewhere in there. And we'll just take a quick look at that in tabular. So here I'm in single family, non-institutional, private house as a place of occurrence of the external cause. Some of this has to kind of be inferred, I suppose. And then notice now we get so specific as to the actual room. So kitchen, dining room, bathroom, bedroom. There's not really living room here. I think as specific as we can get is that 9. So we got that X08.11, again placeholder XD, and then the Y92.019. Really, I think is, we could maybe say other if we knew that it was the living room. We could do .018 for a place of occurrence code. So when you do the practice for this chapter, I did just make that about the external cause code, so don't worry about coding injuries. But of course, if this were an actual patient record, this can't be my principal diagnosis. We would have to code that burn. And of course, if we have the whole record, we'd have a little more information as to exactly where that burn was and hopefully the degree and those kinds of things.